What is breast cancer? Breast cancer is a cancer that forms in the cell of the breast. After skin cancer, the breast cancer is the most common cancer diagnosed in women in United States. Breast cancer can occur in both men and women, but it is far more common in women. Substantial support for breast cancer awareness and research funding has helped create advances in the diagnosis and treatment of breast cancer. Breast cancer survival rate have increased and the number of deaths associated with the disease is steadily declining, largely due to the factors such as earlier detection and new personalized approach to treatment and better understanding of the disease. There are different types of breast cancer: angiosarcoma, ductal carcinoma, inflammatory breast cancer, invasive lobular carcinoma in situ, male breast cancer, Paget disease of the breast, recurrent breast cancer. What are the symptoms? The sign and symptom of breast cancer may include a breast lump or thickening that feel different from the surrounding tissue, changing in the size, shape, appearance of breast, changes to the skin over the breast such as dimpling, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of the skin surrounding the nipple or breast skin, redness or pitting of the skin over your breast like the skin of an orange. What are the causes? Doctor know the breast cancer occur when some breast cell begin to grow abnormally. These cells divide more rapidly than healthy cell and do continue accumulate, forming a lump or mass. Cell may spread through your breast to your lymph node or other part of your body. Breast cancer most often begin with the cell in a milk producing duct. Breast cancer may also begin in the glandular tissue called lobules or in the other cell or tissue within the breast. Researchers have identified hormonal style and environmental factors that may increase your risk of breast cancer. What is inherited breast cancer? Doctors estimate that 5 to 10% of the breast cancer are linked to gene mutation passed through generation of a family. A number of inherited mutated genes that can increase the likelihood of breast cancer have been identified. The most well known are breast cancer gene 1 and breast cancer gene 2, both of which significantly increases the risk of both breast and ovarian cancer. What are the risk factors? A breast cancer risk factor is anything that make it is more likely you will get breast cancer, but having one or more even several breast cancer risk factor does not necessarily mean you will develop a breast cancer. Many women who develop breast cancer have no known risk factor other than simply being women. Number one, being a female. Women are much more likely than a men are to develop breast cancer. Number second, increasing age. Number third, a personality history of breast cancer. Number four, a personal history of breast cancer, a family history of breast cancer, inherited gene that increases the risk of cancer, radiation exposure, obesity, beginning your period at a younger age, beginning menopause at an older age, having your first child at an older age, having never been pregnant, postmenopausal hormonal therapy. What are the prevention? Breast cancer risk reduction for women with an average risk. Making changes in your daily life may help to reduce your risk of breast cancer. Try to ask your doctor about breast cancer screening. Discuss with your doctor when to begin breast cancer screening exam and tests such as clinical breast exam and mammograms. Talk to your doctor about benefits and risk of screening. Together you can decide whether breast cancer screening strategies are right for you. Become familiar with your breast though through breast self exam or breast awareness. Sec- Second, drink alcohol in moderation, which can cause increase the risk of breast cancer. Exercise most day of the week. Aim for at least 30 minutes a day exercise. Limit postmenopausal hormone therapy. Combination hormone therapy may increase the risk of breast cancer. Talk to your doctor about the benefit and risk of hormonal therapy. Maintain a healthy weight. If your weight is healthy, work to maintain that weight. If you need to lose weight, ask your doctor about healthy strategies to accomplish this. Choose a healthy diet. Women who eat a Mediterranean diet supplemented with extra virgin oil and mixed nuts may have reduced risk of breast cancer. The Mediterranean diet focuses most on plant-based foods such as fruit and vegetable, whole grain, legumes and nuts. People who follow the Mediterranean vegetable, whole grain, legumes and nuts are are less chance of getting the breast cancer. What are the diagnosis and treatment options for the breast cancer? Different kinds of tests are performed to find the breast cancer. Number one, breast exam. Your doctor will check both of your breast and lymph node in your armpit, peeling for any lumps or other abnormalities. Mammogram. A mammogram is an X-ray of breast. Mammogram are commonly used to screen for breast cancer. If an abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic procedure. Breast ultrasound. Ultrasound uses sound wave to produce images of the structure deep with the body. Ultrasound may use to determine whether a new breast lump is a solid mass or fluid cyst. What are the treatment options? Breast cancer surgery is the first option. Number second, removing the breast cancer lumpectomy. Number third, removing the entire breast. Number four, removing a limited amount of lymph nodes. Number five, removing several lymph nodes. Number six, removing both breast. Radiation therapy is another option. Radiation therapy uses high powered beam of energy such as X-ray and proton to kill the cancerous cell. Radiation therapy is typically done using a large machine.